Welcome to Medical Doctors. Today's topic, breast cancer. I will be your host, Dr. Sean Model. Did you know that women have a 1 in 8 chance of getting breast cancer, with the highest rates occurring in North America and Northern Europe, and the lowest rates occurring in Asia and Africa? Breast cancer is a malignant growth that occurs in the breast tissue, commonly found in the lactiferous ducts. Risk factors for breast cancer are divided into two categories, non-modifiable and modifiable. The non-modifiable risk factors are age, previous breast cancer, race, and genes.
You mean these genes?
No, silly. Genetics.
Oh.
Modifiable risk factors for breast cancer are physical inactivity, alcohol consumption, weight gain after menopause, and having an abortion.
Are there any risk factors specific to women?
Yes, the risk factors specific to women are first pregnancy after the age of 30, menstruation before the age of 12, and menopause after the age of 55. These factors can increase a woman's chance of getting breast cancer because they affect the length of exposure time to estrogen. And the longer you're exposed to estrogen, the greater your risk. Ways to reduce your risk of getting breast cancer: being physically active, 30 to 45 minutes, 3 to 5 days a week with a low to moderate intensity, and doing any exercise that you would enjoy doing. That could include walking, cycling, muscle strengthening. Other ways to reduce your risk: being pregnant. Now, with being pregnant, we're not promoting you to get pregnant, but because that you are pregnant, it reduces your estrogen level, which decreases your risk. And also breastfeeding after pregnancy. And trust me, I would know this. I'm a doctor.
Hi, my name is Beth, and I was diagnosed with breast cancer when I was 51, or back in about 2006. This kind of came as a big surprise to me because I had never really had a family history of breast cancer. However, 2 years before, back in 2004, I was diagnosed with lobular carcinoma in situ, which is actually not a breast cancer per se, but it is a tumor marker for cancer, and your risk of getting cancer when you have that is, of course, much higher. This had surprised me though as well because, again, I didn't have any significant family history. I've never been a smoker. I don't drink. I'm an avid exerciser. I exercise at least 4 or 5 times a week, and have tried to control my weight. And I wasn't even postmenopausal yet, and I still was diagnosed with breast cancer. One thing that I've learned for women with breast cancer is that there is a very active informal support group. There's a great network of people out there who've had breast cancer, really have a real bond when we know that another person has had breast cancer. For instance, I can sit and visit with several people at the exercise club where I work out that have had breast cancer, and we sit and talk and we'll support each other even while we're exercising. Many communities, though, have very formal support groups for breast cancer survivors, and you can find out about those when you see your doctor, at a hospital, clinic, or by going online. My recommendation for any woman, is to have a baseline mammogram between the ages of 35 and 40, and then annually after the age of 40, or 10 years before a family member who has had breast cancer was diagnosed.